Okay, this is the strangest story. What if you lose weight and then you find out it made you smarter?
Well,
is that weird?
Popular surgery appears to do just that. Dr. Kim Mulvihill joining us. I like the smarter part.
Who
don't we all?
Exactly, don't we all? We're talking about gastric bypass surgery, where surgeons dramatically shrink the stomachs of obese patients. The latest benefit may be a boost to your brain.
In the United States, with most Americans overweight or obese, the demand for gastric bypass surgery is booming. The procedure often results in dramatic weight loss. Patients who lose weight after gastric bypass can see lots of health benefits. It improves sleep apnea, high blood pressure, and cholesterol levels. It cures diabetes. Well, here's another benefit. It makes them smarter. Stanford researchers found gastric bypass surgery improved a patient's ability to remember, to think through problems, and pay attention to details.
We saw pretty big improvements across the board for people.
Dr. John Morton headed up the research. He presented his findings late today at the American College of Surgeons annual meeting held this year at Moscone Center in San Francisco.
This is the first study of its kind, and so it's going to open up a lot of other avenues for research.
As to why the brain boost, scientists don't know for sure, but the answer may be percolating in toxic belly fat. That fat can release harmful chemicals that trigger inflammation. Get rid of that fat and your brain benefits.
We know this operation, gastric bypass, really improves insulin resistance. It cures diabetes 82% of the time. And I think at the end of the day, that's really the main reason why these patients had such a big improvement in cognition after surgery.
Now, this is the first study to look at brain power after weight loss surgery. So what about weight loss without surgery? If you lost 100 pounds, would you score better on tests? Probably yes, but getting the weight off is the hard part. For the morbidly obese, only surgery has been shown effective at this point.
You had to bring up that toxic belly fat again, didn't you?
Sad, really sad, but true. You know, you've got to think about it. That fat isn't just sitting there. It's hormonally active, and that's the problem. It triggers inflammation, it triggers insulin resistance, diabetes, all of that. But the good news, Wendy, the good news, yes, I always say this, it's easier to take off than that fat that's sitting in other parts of our bodies. So,
gee, I haven't found that.
I wasn't directed at you. You hate it when I always say diet and exercise, but sorry.
No,
if you're going to go after fat, go after that fat.
That's right. That's the one we got to get rid of. Okay.